So you think the NCLEX is just the test of what you know? Well, that's really only half the story. It's not about how many facts you can memorize. It's about making the right call when it really counts. And that's why today, we are cracking the code on the single most important skill the entire exam is designed to measure, your clinical judgment. So what is this #1 skill, really? You can think of it as the engine that drives everything. Not just every correct answer on the test, but every safe, smart nursing decision you're going to make for the rest of your career. And that skill is clinical judgment. The official definition calls it the observed outcome of critical thinking and decision-making. But let's be real. In simple terms, it's about what you do with what you know. And trust me, the entire exam is built around this one core idea.
So here's our game plan. We're going to break down the 6-step thinking framework you need. I'll show you how to decode any question and strategize your answers. We'll talk about the common traps to avoid, and then we'll put it all together with some real examples. Let's dive right in.
First up, let's get inside the exam's logic. You know, the people who write the test, the NCSBN, they aren't actually trying to trick you. They've basically published the secret map they use to build their questions. It's called the Clinical Judgment Measurement Model, or NCJMM for short. And here it is. This is the whole thing. 6 steps, 6 skills you can use on every single question. First, you recognize cues. What's important right now? Then you analyze those cues. What does it all mean? Then prioritize hypotheses. What's the most urgent problem here? From there, you generate solutions, take action, and finally, you evaluate the outcomes. This isn't just the list, you guys. This is your mental checklist for success.
Okay, so with that framework in our back pocket, we can start building out our toolkit. And it all starts with the question itself. Before you can even think about finding the right answer, you have to understand what's really being asked. The name of the game here is discipline. You have to focus only on the information they give you. No adding your own story. Try to actually visualize the scenario like you're right there in the room. Figure out the core subject. Know who the client is. And then, this is huge, hunt for those strategic words that can totally change the meaning of the question. Think of these words like little signposts. Anytime you see a priority word, like best, first, or immediate, that's your cue that this is all about prioritization. Words like assess or monitor are pointing you directly to the first step of the nursing process. And then you have the tricky ones, the negative queries like need for further teaching. That flips the whole question upside down. You're actually looking for the wrong answer.
Okay, so you've cracked the question. Now it's time to attack the answers. Your goal isn't just to find the right one, it's to get rid of the wrong ones with absolute confidence. And this right here is probably the most powerful tool you have. I'm not kidding. Never ever jump to the answer you think is right. You have to read every single option and physically, or at least mentally, cross out the ones you know are wrong. It seriously bumps up your chances of landing on the correct answer.
And let's add a few more pro-level tools to your toolkit. If you see 2 options that are kind of saying the same thing, yeah, they're probably both wrong. Be super skeptical of absolute closed-ended words like all or never. Always be on the lookout for the umbrella option. That's a broader statement that might actually include some of the other, more specific answers. And hey, when you're in doubt, always fall back on your core frameworks, like your ABCs.
Now let's flip this around and talk about what not to do, because knowing the common traps is just as important as knowing the right strategies. This is that insider advice that can really make the difference.
I want you to pay close attention to this. This simple little question, well, what if, is the #1 way students go off the rails. It's how you start reading things into the question that just aren't there. But wait, there's a huge twist to this rule. And this distinction is absolutely crucial, so listen up. For your classic traditional multiple choice questions, asking what if is a total no-go. You stick only to the data they give you, but when you get to the newer, next-generation case studies, you have to ask what if. Those NGN items are specifically designed to test if you can see what might happen next. Knowing which rule to apply is a game changer.
All right, that's enough theory. Let's see how all of this actually works in a real scenario. We're going to walk through 2 different kinds of questions and apply our toolkit every step of the way. Okay, here's our first case. Picture this. You have a client with heart failure who's suddenly short of breath. You've already done one smart thing. You put them in a high Fowler's position. Now what? What's next?
The question wants to know the immediate action. See that strategic word, immediate? That's our huge clue to think about priorities.
We've got 4 options: give O2, call the doc, give a diuretic, or assess. What does our framework tell us is the very first thing to do?
And the correct answer is number 4. But why? Because you always follow the nursing process. An assessment is the first step. You need data before you can act. That word immediate points us right there. This is also a perfect example of avoiding that what-if trap. We can't just assume it's pulmonary edema and jump to giving Lasix without actually assessing the client first.
Okay, let's switch gears to a next-gen style question. This requires a totally different kind of thinking. We've got a client who was just diagnosed with type 2 diabetes, and we need to look at their data over the last 24 hours. So here's a chart they give you. The question would probably ask you to highlight the findings that are essential to follow up on. So just take a quick second, scan the trends, what's jumping out at you, what's getting worse. When you really break it down, you see that pretty much everything is heading south. The pulse and respirations are climbing. The glucose is sky high and getting worse. And that potassium and urine output, both are critically low and trending down. These are all alarm bells for a crisis, and this is exactly where you must play that what-if game to connect all these dots. So you see, in both of those examples, it wasn't about knowing some obscure fact. It was about having a system. And it all comes back to that 6-step framework, a reliable process you can use on any question the NCLEX decides to throw at you. And remember, when you're under pressure and have to make that split-second decision on what matters most, just lean on your fundamentals. Your ABCs, airway, breathing, circulation, are king in an emergency, period. After that, you look at physiological needs with Maslow's, and you always follow the nursing process.
We've unpacked the logic, we've reviewed the strategies, and we've walked through the whole process. The NCLEX isn't some unbeatable monster. It's a puzzle. And it's a puzzle that rewards a very specific way of thinking. The good news is, you now have the toolkit to solve it. So the only real question left is, which strategy are you going to master first?